also have personal experience with oncology because both my dad, he had lymphoma. My mom had lung cancer, and she was actually cared for by one of my partners in this practice. So I've been through that experience so I can help other patients who've gone through that experience, because I've had that experience myself. There's so many advances that it's hard to keep up with them all. There's so many drugs that have been approved in the last couple of years. Back in the 1990s, when I started giving chemotherapy to patients, there was a handful of drugs. I knew them all. I knew exactly how to administer them all. Now I have to look up everything again, everything to review it so that I can make sure that I am making the best choices for our patients. But there's NCCN guidelines and so forth, so it's pretty straightforward for most patients because there's certain things that we see the most, like breast cancer, colon cancer, lung cancer, lymphoma. I think people have a misunderstanding of cancer. Cancer is not one disease. It's, you can have breast cancer. You can have breast cancer that is estrogen receptor positive or estrogen receptor negative. You can have breast cancer that is HER2 positive or HER2 negative. You can have, and those are things that help guide us towards the treatments. We also have Oncotype DX testing. We have now the Prosigna panel that we can get so that we can target our treatment options for each patient. So it's gone beyond what I ever thought it would go. Part of the reason I'm a little bit slower seeing patients is because I take a little bit more time because I do have a bond with my patients. Yeah. And that makes me more satisfied with my job. It's more hopeful than people realize because you are able to help people live longer lives with more quality of life, even if they're not curable, and you can help support them through that. And that's, I guess, what keeps me coming every day.